it's not being picked up on a pap smear, I mean, this is something that can develop into cancer. I mean, if I'm testing for HPV.
If you're testing, yeah, if you're testing for HPV, that will help you in making diagnosis where there could be possibilities of dysplastic, cells and things like that happening.
Mm-hmm.
But again, the dysplastic cells themselves are not exfoliating, and that part would not be picked up
Okay.
with a pap smear. And then in the last example here, you can see that the abnormal cells just do not exfoliate at all, and then they would not be collected. So again, it's not how you are doing your pap smear, it's a biology issue, and these cells are just not exfoliating.
And why would that be? Why wouldn't they exfoliate?
Well, let me show you on my next slide here. I've got some actual pictures of dysplastic cells in the epithelial layer of a cervix. Now this is what they found in a recent study that was introduced last year, October of last year, at the 68th annual Pacific Coast OBGYN Society meeting. There was a study done by Dr. Juan Felix, and what he found is that there's now these adhesion molecules called ecahedron molecules
Mm-hmm.
that are found in the epithelial layer. And what they're finding now is that these adhesion molecules are being found throughout the entire epithelial layer instead of just mostly being found down at the basal or the lower part of it. And what's happening, these cells are being clumped together and holding the dysplastic cells, not allowing them to exfoliate. And that's what could be causing this example right here, where they're just not exfoliating.
Are you saying that even if I'm
Mhm.
drawing blood in some cases to get at everything I can to collect, are you saying that it wouldn't even be picked up on something like this?
Yeah, no matter how well you do or how hard you try to get cells, it wouldn't be picked up if they do not exfoliate. I mean, you would have to literally scrape them off, and there's certain examples where this may be below the surface of the cervix, and then even if you were drawing blood, it would not be collected. It's below the surface, and you're not able to find those.
Well, frankly, it's news to me. I didn't know, about this. But I mean, do you have? I mean, you're talking about Dr. Felix, the study. Do you have a copy of that, or?
I have a copy
do you have any? Can you give me any specifics on it, even? Or?
Yeah, and I have a copy of that. It's so new that what I can do is have a copy of that faxed to you. But basically, what Dr.
I mean, how common is this? In other words, that's maybe what I want to find out from you.
It may be as high as 90% of your women that have dysplastic lesions may be non-shedders, where the cells are not exfoliating. What they did in this study was that they took 25 women that tested positive for dysplastic lesions, and with those women, they did a pap smear with all those women. The ones that came up as a negative pap smear, showing normal, everything was fine, they found that 10 out of 11 of those women had the ecahedron adhesion molecules throughout the entire epithelial layer. So it was holding those cells together, and it came up negative because they weren't, the women weren't shedders. Now the other women that had a positive pap smear.
So about half, actually, of the negative.
About half. About half. A few of those had to be thrown out for different reasons out of the study. But yes, 10 out of 11 had the adhesion molecule throughout the epithelial layer. Now the ones that came up positive, what they found was that those adhesion molecules were staying down in the basement and down in the lower level of the epithelial layer.
Okay.
So those cells were shedding off and were found. So they were found to be abnormal.
Okay, thank you. I mean, that's news to me. I didn't know about that.
And this, I will have that fax to you, so you'll be able to see that too. But this whole study, the Felix study, as we call it, is going to be presented at ACOG this May. So it's something that everyone is going to be able to see this. So you can see this does make a difference in cervical screening.
Yeah. Well, you don't need to fax it to me. I mean, you just answer my. Yeah, I understand what you're saying. I mean,
Okay.
That's very. And if it's going to be presented at ACOG, I mean, that's really what I kind of, to be honest with you, try to set my guidelines on my practice by ACOG, and I mean, how do they? What is their stance on this?
Right now,
on the pap smear examination.
On the pap smear
Yeah.
itself, right now they're neutral in their stance with pap smear. Neither, they neither have anything negative or positive about it right now because it's such a new technology. But again, that will all change as these kind of things are presented at ACOG this year, and more people actually become acquainted with pap smear.
That's very interesting.
Let me show you how pap smear can make a difference now. with your patients that have, you know, that are basically non-shedders here.
Okay.
And that's how we do it, because, you know, PAPSure is a visualization. So you're taking the results from a lab test along with the visualization that you will do in order to increase that sensitivity that we talked about earlier.
Okay.
So we're not relying just on the lab. We have a backup. We have a backup here. Your eye and your expertise
Okay.
on making these things. The PAPSure test is a simple and easy to use test here. The materials that you'll need for the exam is a speculite, which is a disposable chemiluminescent light source that emits a low energy wavelength. Now this speculite and the light source has been developed over the last 10 years. And what they did, they had to develop the exact right wavelength that would penetrate the cervix and allow you to see the acetowhite lesions, and even see lesions that may be below the surface of the cervix too.
And what do I do? Just hold the light up in my hand, or?
Well, what you do is the speculite is activated. This is a picture of the speculite. You would take the speculite and activate it by snapping it, shaking it, and it emits a blue light. And that's the low energy wavelength there. And then the speculite is attached to the upper.
How big is that thing?
It's approximately about this size right here.
Oh,
And
okay, it looks
it'll-
big, it looks gigantic in that picture.
Yeah, that's not a real good refuge. You know, they did it up close for that.
Okay,
But it's probably the width of like a pencil, and probably about this size right here.
okay. Does it go on any speculum? Because to be honest with you, I don't have the plastic ones. And
No.
just in case a patient asks for it, I have plastic, but,
No, you can apply this to any speculum. There's a double adhesive tape that's included in the kits, where you apply the speculite to the upper inside blade, dilator blade of the speculum.
mhm.
Okay, and then you would go ahead and perform your pap smear as you usually would do, and then you would go on to the PAPSure exam, and that's as easy as applying the acetic acid to the cervix, waiting 60 seconds, and then you would dim the lights and look for the acetowhite lesions with a 6 times magnification optic.
Okay, something I mean, I'm a busy man.
Mm-hmm.
I mean, I don't even get home till 7:30 at night sometimes, and I mean, this seems like, it's all nice and fine and dandy, but I don't know if I have the time to do something like this. You know, if I figure I probably do 25 paps a day,
Mm-hmm.
you're asking me to, spend about 5 minutes or so with each patient for this exam,
Right.
on top of what I'm already doing. I mean, that's pretty significant. I mean, how's this gonna work? How am I gonna get that to work?
Yeah, basically when you get used to doing the exam, it's basically going to take you about 2 minutes to do, with the longest time being the 60 seconds waiting for the acetic acid to absorb into the cervix. Then you would spend approximately another minute doing your actual visual exam. So about 2 minutes is all that you'll spend on the visual part of this exam for you. And then again, does 2 minutes? I mean, I know your time is valuable.
Minutes per
but
patient, Chris. 25 patients a day,
Mhm.
times 2, that's 50 minutes, another hour. I don't know.
Now, what if I
Yeah.
told you that with this, you'll be able to, I understand you're going to have to spend more time on this, but you're also, with this exam, you're going to be able to charge those patients a fee for this exam, and you're going to be able to not bill them, but collect from them for your time in doing this exam. Would that make a difference in how you look at it if you're going to get paid for that extra 2 minutes? Would that make a difference?
Actually,
I mean,
now that you say it like that, I mean.
time is money, I know
Yeah,
that, so it's
yeah.
important to you. But if
Well,
you're able to collect on
Well,
this.
that's it, but what am I gonna get reimbursed for this? I mean, just because I'm charging for it, I don't know when I'm gonna get reimbursed.
Okay, well, right now, PAPSure is not covered by insurance coverages. What you'll be able to do, and that means that the patient will have to pay out of pocket for this. And that is a concern with a lot of doctors, in my area, that it doesn't have the insurance coverage yet. But if you look at it on the other side, is that when you'll be able to charge a patient what you feel is right for your time and expertise in doing this exam.
And what's the cost of this?
The cost to you would be $20 per kit, which includes everything that you see here to do an exam.
So I can get all this for $20?
Right, $20. They come in kits of 25. You'll be able to purchase those. there's some things on top of that that we also have, that's part of the program that's included in that, in the $20 per kit. Some of the things that we're doing, once you decide to purchase your first kit, there's two things that we will have for you. One is that you will be given an introduction kit, which will have all your patient literature and information. Let me show you what we will provide you with this Hampshire provided intro pack, which will include the cups and the speculoscopy results and the risk assessment stamps, some scopettes, clipboards. It will also include 10 packages of speculite. So you'll get this introduction kit. You will also, I will also set up an in-service where we'll have a PAPSure nurse come in and work with you on 6 to 8 of your patients doing the PAPSure exam with you. So on top of your initial purchase, we're also giving you this intro kit and training for you and your staff on PAPSure.
Hmm. And what I do, just buy all the other literature and stuff?
Everything will be included in the intro pack, and if you were ever in need of any other literature in the future, that would all be supplied for you at no cost. So there's no cost for any literature, anything like that for you.
Hmm.
So again, you get, in the introduction kit, you get 10 speculites to be able to use. Like I said, the nurse will work with you on 4 to 6 patients using those. Any speculites that are left over are a bonus for you to be able to use in the future. So you've got some extra ones right there. And then again, all the patient literature and training will be done between the PAPSure nurse and myself.
So you're saying the kits are $20, and I get 25 speculites for that?
They're $20 per speculite kit. It's a disposable kit.
Oh,
For each
$20
patient.
per speculite.
Per speculite kit.
Hmm.
So that would be an initial.
And the patients pay out of pocket for that?
Right. They would pay out of pocket for that. And what all you would do is just offer them PAPSure. What we're going to be doing on my side of it is that we're going to be selling this for you. We're going to start out first with a direct-to-consumer advertising campaign to get them aware of PAPSure and drive them into your office asking for it.
They're going to be asking for this?
Come in and
Okay.
ask you for it. And that's why it's important. I wanted to set up this appointment as soon as possible, let you know about PAPSure, let you get set up with PAPSure. So when they come in asking for it, you'll be ready to go with it. And what we do is we know that you don't want
When are they doing that, Chris?
next month, they'll be starting a direct-to-consumer advertising campaign, media, literature. I'm even hoping for a large name celebrity to come out and back this procedure.
Are they going to be willing to pay for this out of pocket? That's my concern.
Well, it's
You're
gonna
asking me to buy a box of these speculites, and are they really going to pay for this?
Well, that's where this is something that can give them added peace of mind on a cervical screening, on top of their Pap smear. The cost, for a minimal cost on a one year exam, most women would be more than happy to pay that additional money one time a year to have that extra peace of mind.
Yeah, but if it's costing me $20, what do I mark it up to? What does your company recommend?
We really don't have any recommendations in that. That would be up to you on what you would want to mark that up to. What would you think would be fair for your time and expertise on an exam like this above the $20?
Well, for a $20 cost to me, I wouldn't charge anything less than $40 to make it worth my while.
Okay.
But will the patients pay for that? I just don't know.
Where do you think they would have the concerns with it?
I have trouble collecting the copay, to be honest with you, and I'm billing for that. They don't even want to pay their $5 or $10.
Okay. Well, where we're going to help with that on the patients making their decision on whether they would like to do this PAPSure is we have a clipboard system that I would train your front staff on that would let the patient know all about PAPSure and its features and benefits and how much it will cost. And once they read this Dear Patient letter and find out about the added advantages of PAPSure, I think that they'll be more than happy to pay for the extra, you had mentioned $40 or so for the kit. This explains to them exactly what the exam involves, how much it will cost, and that they are obligated to pay that at the time of the exam. There's also, we also provide a consent form or payment form where the patient signs yes that they will pay for the exam, and then they sign for it.
Yeah, I don't even know if I can do this. I mean, I belong to, I have a contract with Cigna and Aetna and, you know, all the big HMOs. And, you know, I really kind of limited to, I'm not really allowed to charge outside of, you know, what they deem as the appropriate procedures to follow, you know what I mean?
Right, right.
I mean, I even had a Baycare, which was in Florida, and I mean, they threatened the, I remember this kind of sounds like thin prep, the way they kind of launched it, but I even remember they sent me a letter saying that, you know, they were gonna cancel my contract, you know, if I kept on doing these procedures. But, I mean, is this
Well, what we
basically legal?
Yeah, I mean, we've had this, your question came up quite a bit when we were in the investigative stage of how we were going to launch this and how we were going to have the patients pay for this. And our legal department researched this thoroughly. And as long as they agree and sign this consent form, there's no problem at all as far as with your insurance companies, you breaking any type of contract with them or anything like that. This is an added service that they've agreed to pay for themselves out of pocket, and you won't have any problem with your HMO. This is like if you had a procedure, say you were doing another type of procedure in the office. You know, I've had some doctors talk about, they do some hair removal or some type of possibly wrinkle removals or things like that. It's an elective procedure that they agree to pay for, and as long as they sign a consent form, you won't have any problem with your HMOs.
And who's doing this now?
In my area?
Somebody I would know, I guess. But
Right now, I'm still in the process of introducing this to all my doctors. I've had a number of doctors that have, and right now, I haven't had anyone that's signed up for it. There's been a lot of interest for this, but I haven't had anyone in my territory per se start with PAP sugar. Now, throughout Florida, we've had great interest in some of our other territories. A number of doctors have also signed up and started with that.
And are they seeing movement or reorders on this thing? I mean, are patients actually signing up for this?
Signing up for the...
Yeah, basically like coming in and, I mean, even though they're buying it, or how much, I guess my concern is, how many patients are really gonna do this?
Well,
I mean, are they willing to pay that kind of money, $40, which what I probably would charge as the minimum, to do this procedure?
Well, how many Pap smears are you doing a day per se?
I do 25 a day or so. I mean, it's almost standard.
Okay. Do you think it'd be unreasonable if you're doing 25 with this clipboard system and an information brochure like this on Pap Sure? If each of those 25 were offered the Pap Sure exam, do you think it'd be reasonable to say, 4 to 5 of those 25 would be interested in this?
So you're saying not to offer to everybody, just off? I mean,
No, I'm saying if you offered it to all 25, wouldn't you think that possibly 4 to 5 of those would be interested in this for the extra peace of mind?
Yeah, that's my question. I guess there's also the patient, I just know what's going to happen, to be honest with you. This is what happened with InPrep. I mean, they kind of launched something similar in the way they rolled it out. But, I mean, patients came in and they want to know, Doc, is this something I should do? What do you think? What am I supposed to say? Now I got to spend time with them on that as well. So not only do I have, well, I guess they wouldn't be undergoing the procedure then because they're asking me, but I mean, it's really going to take some time. Where is their interest level going to pique them enough to learn enough about it so that I won't get questions? You know what I mean?
Right. And that's why we've developed this brochure, so they get this in the beginning. When they read this, will answer pretty much 95% of their questions before they get to you. Once they get to you, basically they'll be ready to go. They may ask you what you think of the Pap Sure examination or the whole process, and that's where I need to convince you of the benefit of this exam.
Okay.
That's where we'll work on this part of it, convincing these patients of the exam.
And you're saying basically that benefits of the exam is it picks up those lesions that pap smears miss, and you brought up a sensitivity level.
Right, let me show you that, those levels right here. How we achieved this sensitivity is that we did a large study involving over 3,300 patients. And what we found is that the pap smear alone achieved a 40% sensitivity, where the combination of pap smear and speculoscopy achieved a 92.2% sensitivity. Now this,
And you're telling me that the pap smear misses half. I mean,
right, and our study was about 40%. There was an ACOG study that also did a study on pap smears, where what they found was about a 50% sensitivity. So that would, yes, that would mean that they would miss about half of it. Now combining the results of the pap smear and the speculoscopy, we had a 92.2% result, sensitivity result. And what we did to, in our test, it was done in a European study or trial that we did here. And a lot of times the FDA will not give clearance or approval on a product, based on a European or a foreign study. But in this study, they did it right. They did it with a large number of patients, along with basing everything on colposcopy, which is a gold standard. Every one of these patients went through a pelvic exam, pap smear, the speculoscopy, and then a colposcopy, the gold standard. So when we get these numbers here, that they're not skewed by any way. They're not based on our product being the gold standard. They're based on colposcopy. And that's where you can rely on the 92.2%.
I thought I'd seen studies with pap smears, up 80% or whatever, and you're telling me that's not the case.
I've heard 80, I've heard 90. Most pap smears, they base their sensitivity, like I said, on their own product being the gold standard. And yes, like a thin prep would improve the sensitivity of a pap smear alone, because it's making the cells more visible. So yes, it's going to improve on the pap smear alone. But again, it goes back to, are those cells, it's cells that are collected. What about those cells that aren't exfoliating? What about that woman that's not she's a non-shedder and they're not shedding? It goes back to the Felix study we talked about, and the adhesion molecules holding that in. If those cells aren't shedding, it doesn't matter how good the pap smear is.
Okay, so you're saying because this is with colposcope, every patient's been, had a colposcopy then?
Right.
Okay, no, that makes sense. I should review that literature, but it still kind of concerns me that I just didn't know it was that low.
Right. Here's the journal that I was talking about, the European Journal of Cancer Prevention, and it was the study was done by Dr. Leducci and his associates in 1998. And like I said, all women were subject to the following tests: the pelvic exam, pap smear, speculoscopy, and colposcopy as a gold standard.
Okay.
And from there, we went on and they took the women that were shown, that came up positive in the colposcopies, and compared that to the women that were found positive using the pap smear and the speculoscopy, and that's where we got the 92% sensitivity.
Okay. Well, that's good to know. I mean, you're bringing me something that I didn't realize.
And you see with that type of sensitivity how it can improve a woman's, the woman's peace of mind. Also give you more confidence on your exam too. And that's where it comes back to when they.
Well, I guess kind of going along those lines, I noticed that you're talking about low-grade squamous interepithelial lesions,
Low-grade,
but
sure.
I mean, if it's just picking up low-grade lesions, these women are coming in every year for a pap smear.
Right.
I mean, when I catch it next year, and I don't. What I'm saying is, I don't know if it's really worth my while if it's just picking up low-grade lesions.
Well, you're going to pick up, high-grade lesions also. As a matter of fact, the pap smear exam in our study here, the number of women that had high-grade lesions, all of them were found using the pap smear. If you look right here, of the women that had high-grade lesions, there were 25 high-grade lesions. The pap smear alone detected 76% of those high-grade lesions. Speculoscopy detected 84%. And then the combination of the two detected 100% of them.
Mhm.
So every high-grade lesion that was there was discovered.
Yeah, that's actually pretty impressive. I don't usually see 100% in any study.
So you know if a woman has a high-grade lesion, you're going to find that. And then also 92% of the time with low-grade lesions.
But what I'm kind of asking is, what's the benefit of finding low-grade lesions? I mean,
Well, you're going to be able to, find them early, be able to treat them early, and prevent a woman from going on becoming high-grade lesions and having to do possibly a more invasive, invasive type of procedure in order to take care of that high-grade lesion. Like right now with a low-grade lesion, what's your standard of standard procedure for taking care of a low-grade lesion?
well, to be honest with you, I mean, I've been doing these for a long time, past years, and honestly, I can't tell you the difference between low-grade lesions and high-grade lesions when I'm visualizing anything. If I see a lesion, I'm going to go right to colposcope, and I guess that's where maybe my question really lies. Is this, I'm seeing lesions that I might have not seen with the pap smear. Am I just going to be sending everybody to colposcope? I mean, maybe that's. Am I clear on what I'm asking, or I mean, do you understand what I'm saying?
Yeah, your concern is that everyone, any lesion will go right to colposcopy, and you may be doing
Exactly.
unnecessary colposcopy.
Well, exactly, because I mean, a lot of these lesions,
Mhm.
quite a high percentage actually resolve on their own.
Right,
I mean,
exactly.
you should know that.
Yeah, and as a matter of fact, I've got a study here, another study that was done by Dr. Parham. It was in the Obstetrics and Gynecology in March of 2000, which deals directly with that concern. Do we need to send everyone to colposcopy right away? Basically, what they found in this study was done in Arkansas, and it had a subject group of 800 women and what they did, they tested all of these with pap smears and speculoscopy, and they took half of the positives and went right to colposcopy with them. The other half, what they did, they waited 6 months to see what would happen with the low-grade lesions. And what they found is about 30% of those that they waited on, actually, the low-grade lesions basically dissipated and took care of themselves. It was not a factor after that. So what Dr. Parham found is that as long as a woman is not high risk and is reliable coming back for a re-examination, that waiting 6 months is perfectly fine for a low-grade lesion.
Okay. Now, if I wanted to send those patients to colposcopy right away, I mean, our insurance cover. You said insurance companies don't cover this procedure.
Right.
So, I mean, am I going to get reimbursed first?
Right, yeah.
Doing colposcopies?
That's a concern. If you send someone on, if you're going to get paid for the colposcopy. And yes, as long as if you send them on for colposcopy and you code it as a visual examination, visual finding of something on the cervix, then yes, they have to reimburse you for that colposcopy. It's just like if you did a visual exam with any other type of light source.
Okay.
There shouldn't be any problem right there.
Well, to be honest with you, this might even, help out with the revenue side of things. I mean, I'm kind of getting stretched at both ends. I've got my liability costs going up, and then my revenues seem to be my reimbursements from the HMO seem to be going down. So.
Yeah, again, you're gonna charge and collect what you want for this examination. And how's your colposcopy business right now? Are you doing quite a few, or?
Oh boy, I guess it kind of varies. It's not what my old practice was when I was in, downtown St. Pete. Now it's now I'm kind of hate to say it, but more of an upscale neighborhood, and I don't see the HPV cases, and I don't see a lot of situations where I would have to colposcope. But I mean, I do. I mean, I colposcope maybe 6 times a week.
Okay.
I need to pull it out. So.
Yeah, and looking at it on the other side with this increased sensitivity, you may need to do, or you will need to do, possibly more colposcopies, which would help you on the business side of your practice, doing those increased colposcopies. Of course, you don't want to do any unnecessary colposcopies, and that's where waiting 6 months to retest may work for you. But again, you want to examine something and be able to treat that early and help your patients out.
Now, what happens if I see something? I mean, I might be inclined to just go right to colposcope. What if I miss something, though, with this visual exam? I mean, regarding liability.
Now remember what we're looking at is a combination of the results of your visual exam and the pap smear. So you've got you've got the visual as a backup, or you can even look at it as having the pap smear as the backup. So you've got that result with the pap smear, positive or negative, along with your visual exam.
Okay.
So your liability is going to actually decrease, because you have another backup there on what you're seeing. Where before it was just a pap smear alone is all you were dealing with. And again, that woman's a non-shedder. She's not going to shed. You're not going to find it, and something could be prolonged, and you wouldn't be able to treat that early.
Good point.
So what do you think of the whole Hampshire?
Well, I'm very
process?
intrigued. I'd love to see this. I would see this, Can I take a look at a couple lights? Do you have a couple lights with you, or?
I don't have any samples with me. Like I said, what we do is, with your first order, we would set up the intro pack coming in along with the in-service, where you would get to see the whole process, the whole capture process.
Oh, so you're saying I have to order before I see it?
Right. Would you be interested in ordering, and then we could get the in-service set up?
$500 for the kit and everything, right? Is that what you said?
Yeah, because you'd order a case of 25 at $20 each, so that would be $500. And then you'd also get the extra 10 speculites in the introduction kit, with a few of those to be able to use as you would want after the in-service. And then we have the nurse, the capture nurse that comes in, and she will work with your nurse on the whole process and the setup of capture, and then also work with you on the exam. And I'll be working with the front desk and any other people that may be involved in the capture process, teaching them about the clipboard system, and getting those patients to come in and do the capture exam.
Hmm.
So you're getting quite a lot for that $500. You also there's also a net 30 on your purchase. So you'll have 30 days to offer it to your patients and use these speculites before you'd have to pay anything. And you mentioned before you do 25 pap smears a day. And again, what I was saying, if you get 4 or 5, even 3 to 5 patients a day that will take this, that want to do the capture exam, there's 20 working days in a month. 20 times 3 is you'd use a case of capture easily within a month's time before you'd have to pay anything for it.
What did my office manager say about this? You said you already talked to her.
Yeah, that's the first idea. I wanted to talk with her about your purchasing process and everything like that. And she was actually, she really liked the idea. I could tell that Sally's a real business-oriented person, because her first thing, the question she had, was about who's going to pay for this and how is it covered and things like that. When I started to mention how the patient pays for it and you're going to collect the money, she thought that was great. It's cash coming in. It's the money coming through, and be able to put that in right away into the. So she was all for it. And I talked a little bit with your girl at the front desk, Jane, and I told her real quickly about the clipboard system and the brochures, and she didn't have any problem with that. She knew, I showed her how, if anyone has any more questions besides what's on the clipboard, that she can give them this capture brochure, and that will, like I said, answer 95% of the questions. So she didn't think there'd be any problem to be able to do that. So it sounds like there's pretty good buy-in throughout the office. Just want to find out. I can tell you still have some questions about it. Want to find out where your concerns are. Is it the money? Is it the money part of it?
It just sounds really great. I'm just worried about, are the patients going to, come on board with it. Yeah. But you bring up a lot of good points. You really do.
I know those patients will do it. Once we start with the direct advertising campaign, I'd love for you to be on board before that even starts, so you're ready to go. When the direct to consumer advertising starts, that will bring them in, and this clipboard system will work for you. And once they come to you into the exam, if they do have any questions, you can just tell them that they can be assured with these type of sensitivity numbers that their results, they just have a great peace of mind when they take the exam. They'll know that 92% of the time, if there's something that's found, that there's something there. And even here with the negative predictive value of 99.1%, if it comes up with nothing being negative, you know there's nothing there.
This, I mean, what kind of dating is on this? I mean, do you know?
The ones that I've seen in the recent intro packs that I've looked at have had about 3-year dating on it. So you'll never get anything less than a year dating on it. So that wouldn't be a concern of something expiring. And I'm sure if you did get something close to dating, that you can contact our customer service department and they'll take care of that for you.
Just trying to wonder if I should do this now or whether I should just wait for the patients to come and ask them, since you said next month's a big consumer advertising thing.
Right, next month's, yeah, is when it all will hit. I think it'd be a great idea for you to be able to get it in as soon as possible, and really get experienced with using it. You know, after we do the introduction with the Pap Sure Nurse, time to really get used to using it, and then when the patients come in, you'll be ready to go. Now, I even have, if you want to place that first order, I've got next Wednesday available, and we can set up the in-service with the Pap Sure Nurse, bring her in, and get you guys ready to go.
Okay. Okay, let's do that. I mean, how much should I buy? I mean, what's your minimum order or whatever?
Minimum order is one case of 25. I'd recommend having 2 cases on hand, because again, we went through how many Pap smears you do a day, and even with 3 or 4 patients doing the Pap Sure exam, you're going to go through a case really quickly. So I think 2 would be the optimal amount.
Okay.
How's that sound?
I think I'm just going to do one. I mean, you present a lot of good information here. I would like to see how it goes, but I think I'll just do the one. Go ahead and get the order for one with
Okay.
Pap smear.
Yeah, I'll get with Sally on that, and we'll order the 1 box, and we'll also set up the in-service.
So next Wednesday, that actually works out well for me. I'm here all day. In fact, I think I even have several Pap smears. You might want to check just to make sure. I think I have some lined up.
I'll get with your nurse Jane and see how you're looking on that. Maybe if they can put a few more. If you're a little light on Pap smears that day, maybe she can help and get some more patients in there for you to be able to look at.
Okay.
Okay.
That sounds like a good idea. I mean,
Yeah, I think you're going to really think it's going to make a difference for your patients, and then also for on the business side of your practice. I think you're really going to see a difference too. So
Okay.
I'll get that set up for you. Thank you.
Thank you. Appreciate it, Chris.
Cut.